Module 5, the toddler. Dramatic changes take place in the toddler. Their physical growth is going to slow down considerably. Mobility and communication skills are going to improve rapidly. These kids are determined and often stubborn. This little person creates a new set of challenges. Their favorite words: no, mine, want, and temper tantrums begin to appear. This is a time of unpredictability. They're learning new skills, their curiosity increases, they start to explore more, try new things. They try to assert their independence. They're very curious about the world around them and at times will fear separation from family caregivers. Parenting can be really frustrating and a challenge, especially related to creating a safe environment and discipline. Eric's developmental task: we have autonomy or independence while overcoming doubt and shame. These kids are seeking independence, but they waver between dependence and freedom and gain self-awareness. Sorry about my dog barking. When we're collecting objective data in this age group, remember this is information that's observed directly. It's going to include their height, weight, all those vital signs, and examining the body systems. Especially in this age, it does not proceed in that head-to-toe manner as it would if they were an adult. And we need to really consider the child's age and development. We try and save those aspects of the exam that's traumatic or uncomfortable until last. For example, the nose, the mouth, and the ears. We'll do those last. If they've seen the doctor before, this process might be familiar. Let those family caregivers assist and definitely let them be present. And respect the child's privacy and cover those areas of the body until that area is ready to be examined. Then we take all of that information and describe in detail in our documentation, making sure that your assessment was paying special attention to their specific complaint, and then we plan their care. With their respirations, when we're taking vital signs, make sure that you count those during the quiet time and observe for retractions when they're breathing, which can indicate respiratory distress. For children that are 3 years of age and older, blood pressures will be routine. But if they're under 3, we only do this if a risk factor of heart or renal disease is present. Make sure that you explain that procedure, and you might want to demonstrate on a doll or a stuffed animal. Use that proper size cuff and allow the child time to rest in a quiet environment before you get the blood pressure. If it's really abnormal, check it at least twice, about 1 to 2 minutes apart. We prefer the apical pulse for the younger child. Again, if it's unusual in quality or the rate or the rhythm, make sure that you count for a full minute. If the child has to be on a cardiac monitor for any reason, make sure that you respond immediately if an alarm sounds. The normal ranges for children of various ages, normal blood pressures, their physical development. Again, this is a time of slowed growth, but they have a rapid development. Each year, they're going to gain about 4.5 to 6 pounds and get about 3 inches taller. They're going to have teeth continuing to erupt, especially their molars. They're learning to stand alone and now walk, and they may have learned partial or total toilet training. If you look at the table 24:1 in your textbook, it will show you the different growth and developmental landmarks for this age group. Psychosocially, these kids continue to improve and refine their language skills. They have a growing awareness of themselves, and they tend to test their personal independence to the limit. Behavioral characteristics, negativism. They answer no, not disobeying as much as they're trying to assert their independence. So try limiting the number of questions asked. Instead, make a statement. They go through ritualism, which helps develop security. Following those habitual practices, it helps provide that feeling of safety to the child. Dawdling is wasting time or being idle. Again, this helps the toddler assert their independence. We need to compromise between following the wishes of the caregiver and choosing action. It will depend on the situation for the particular caregiver response when the child does dawdle. Temper tantrums. This is the child reacting with rebellion to the wishes of a caregiver, and the caregiver should remain calm and patient. Don't yield to the child's whims. Try to calm them and prevent injury, and provide that safe, quiet place for them to calm down. Reasoning, scolding, or punishing during a tantrum is going to be useless until the child regains control. At this age, play is going to be parallel with others. They're going to imitate their role models, and the toys they play with should involve gross motor skills or fine motor skills. Excuse me. These kids might not be ready to share with one another yet. Make sure that you keep an eye on their toys for loose pieces and sharp edges that can harm them. And avoid toys that have small items because kids still explore with their mouths. The adult should always be close by, but staying quiet and just watching. Training or instructing in order to produce a particular behavior pattern, especially moral or mental improvement and self-control, is the definition of discipline. Punishment is more penalizing for wrongdoing. These kids are going to learn self-control gradually, and it requires consistency and timing. It's a very challenging period for the rest of the family. One way of dealing with behaviors is extinction, which ignores the behavior if it's not harmful to the child or someone else, and making sure that you praise the child with appropriate behavior. Spanking or other physical punishment can actually teach a toddler that physical violence is an acceptable behavior. So consider that timeout chair. This age group may have difficulty sharing a new baby in the family because that baby presents as a rival for mom's affections. And in that case, they might regress to a more infantile behavior, hoping to get more attention. So parents need to pay special attention to the child, making special preparations might be necessary when they're learning to deal with that new baby. Help the child feel that the new baby is our baby and not just mom's baby or dad's baby. And let the child help with the new baby, making sure that you reserve time to spend alone with the toddler, just like you did before. The new baby came along. Don't try and make this child grow up too soon. So question. Toddlers are famous for their use of the word no. What is this negativism indicative of? Assertion of their individuality. So let's look at nutrition. As with any aged child, they need foods from the major food groups every day. They need their about 1,000 to 1,400 calories in their diet that include fruits and vegetables, grains, proteins, and dairy. We might see some eating problems in this age group. Their growth rate has slowed, so they might not want or they may need less food. They do have that strong drive for independence and autonomy that compels assertion of will to help prove their individuality. We often see food jags in this population, which is a desire for only one kind of food. I just want macaroni and cheese. Messiness is to be expected and prepared for because this is a learning process that takes time. But as the toddler learns, we will see improvement. So tips for feeding the toddler: give them small portions. No one food is going to be essential to their health, so don't stress and stew if they don't eat enough of a particular food type. These kids like simply prepare foods served either warm or cold. Provide that social atmosphere. These kids prefer finger foods. Plan regular meal times with small nutritious snacks in between meals. Understand that at mealtime, dawdling is common, so don't let mealtime exceed 20 minutes. Once we hit that 20-minute mark, then just calmly remove their food without comment. Don't make desserts a reward for good eating habits. Regularly offer planned, nutritious snacks midway between the meals and again at bedtime. The total amount eaten every day is going to be more important than the amount eaten at a certain specific meal or a certain time. These kids require routine checkups about every 15 months for immunization, or at 15 months, they'll need immunization boosters, and then they'll need those annually. They need to have their growth and development, oral hygiene, toilet training, daily health care, family caregiver and toddler relationship, and parenting skills assessed. Effective communication is essential. So check out more details on Table 24.3. With family, we need to teach that bathing should be set at a regular time and always supervised. Provide toys for the bath. Avoid using bubble baths. Never leave the child alone in the bathtub. As far as dressing, allow the toddler to dress themselves as desired. Provide clothes that are easy for the toddler to handle. With dental care, teach them to brush their teeth at about 2 years of age. Their first dental visit should be soon after their first birthday. And encourage proper care of the baby teeth because it will affect the normal growth of their permanent teeth. Toilet training. The timing is an important aspect. Those muscles have to be developed enough. The child can start to connect different actions and results to going to the potty. Families do need to be alert for readiness of the child to learn, and have patience and understanding. Tips for toilet training: get the child a potty chair, but only leave the child on the potty chair for a short time. Have the child wash their hands after sitting on the potty chair. Dress them in clothes that are easy for them to remove, and allow them to observe others with toileting activities. In the beginning, they may have a bowel movement or wet diaper soon after they get up from the potty chair, but understand this is not willful defiance. Empty the potty chair after the child leaves the bathroom, and don't flush the toilet while the child is sitting on it. And don't tease them about being reluctant or unable to conform. In other words, don't expect perfection. These kids need about 12 to 14 hours of sleep during the first year, which decreases to about 10 to 12 hours by age 3. They soon give up their morning nap, but most will continue with an afternoon nap. And bedtime rituals are common and very important. So, question: true or false? Nursing assessments that are made at well-child visits include the caregiver-child relationship and parenting skills. True. And now for the post-test.